1, 2.
And she just went, "Have you got anyone with you?" And I went, No, I'm on my own.
Have you got anyone with you? The question that made Steve Hoskins go, "There's something more here."
Check 1, 2.
It's the anthem of the streets. With the heart of a lion, we will never face defeat. No pain, no gain. We rise above the flames.
Yeah, okay, so Steve, thanks so much for coming on Check 1, 2.
No, thank you for having me on.
No problem at all, honestly. I think just to start off, just give everybody a little bit of context, a little bit of background, like your story, as much detail or as little detail as you want, and yeah, we'll ask questions and stuff after that.
Yeah, of course. No problem. So do you want me to start from the beginning now, or just give a brief sort of
No, just
overview
start for the
first?
beginning, and
Yeah.
you just tell your story. I might interject with a question here or there, but as long as you're happy, I'm happy.
Yeah, of course. So, like I say, I wanted to do this more just to help others that are going through similar, because I found your podcast really helpful to me. So basically, it's coming up to 2 years. I sort of noticed any signs of any symptoms. So that's the end of July 2024. And basically, it started off, I just noticed just a bit of a lump and a swelling. I'd just gone to the toilet one morning, and that was it. And I just thought I should maybe get that checked. And like most people do, I thought I'll leave it till Monday. This was a Thursday or Friday, so I thought I'll see how it goes over the weekend. And yeah, that was it. And I've always been quite good at getting things checked out. And I'm also that age group where when I was at college, Lance Armstrong was massive, so I sort of had an awareness of TC, and I would say I probably didn't check myself as often as maybe we all should, but I did fairly regularly, and even to this day, I don't think there was anything there even a day before. I noticed that it just seemed to appear one day. So anyway, I left it for a couple of days, and I'm a para athletics coach, but it's mostly voluntary. So I coach wheelchair racing, and we were sort of the athletes were preparing for the Paris Paralympics at the time. So I'd been training that day. I use a hand cycle, so I'm always quite active and keep myself healthy. And then it got to the Saturday morning. Again, I've been out training, done about 13 miles on the bike. I just got home, showered, and I just really wasn't happy. I thought this doesn't seem right. So I took myself to the out of hours GP at the hospital. I got seen pretty quickly. Anyway, I got examined, and they just sort of asked, "You can't see anything obvious," and they asked me 3 times to pinpoint it, but they weren't that concerned. And this isn't me against the doctors or anything. They all do a fantastic job. It's really high pressured, but they just sort of thought it might be an infection, so they gave me some antibiotics and said, "Take these for 2 weeks, and if it doesn't go away, come back." So there was a bit of a mix up with the dosage, so it was a couple of days later I actually started taking them. And weirdly, that evening, the day I'd started taking them, it did seem to go down. I don't know if it was just me thinking that, but I thought, oh, maybe it was. And then it was a couple of days later. So this is now a week since I'd noticed the first symptom. I've been at the track, done a session. It was quite hot weather. And I got home and I was just preparing dinner. And I suddenly became really hot. but it was a hot day anyway, so I just thought I'd not drank enough. I just got horrendous lower back pain and kidney pain, so bad I just lay on the bed for half an hour.
Right, wow.
And it was so bad, and I'd never normally do this, but it was so bad I rang 999. So it being summer, the ambulances were really busy. They said it might be 3 or 4 hours till they could get to me, and I was in that much pain. I knew I couldn't drive, otherwise I would have took myself.
Yeah.
And family were on holiday, and again, I didn't think how serious this might be, so I didn't reach out to a few friends who would have took me. I just thought, just be something or nothing. So anyway, it sort of eased enough I could get up and get an overnight bag packed if I needed it, and tidy away what I'd prepared for dinner because I didn't feel like it. And then the doctor from NHS 111 rang back and said, the ambulance is going to be a long time. We'll get you a taxi. So they actually prepared a taxi for me to get me to A&E. So I got to A&E for about 9:30 on the Thursday evening. And I'll never forget when I checked in. I gave my name and they asked what my symptoms were, and a woman on reception, she didn't say anything, it was just a look, and she just went, have you got anyone with you? And I went, no, I'm on my own. She went, all right, just go and sit down. But I could just tell by the look that it was probably something quite serious. But again, I'm quite a relaxed person. I was quite calm. So as I sat in the waiting room watching the Olympics on my phone, I had my earphones in, and it was several hours later I got seen, which I knew it'd be a long wait, and pressures in A&E. Anyway, the staff were brilliant. I got seen by a doctor, given some painkillers for the pain, and they checked my bloods and my urine. And the first doctor again was a bit confused. They were like, I'm not sure what this is, and luckily there was 2 urologists on that evening, and they again rechecked bloods and urine and retook them. And they basically just said, take these painkillers, go home, and come back tomorrow to a day unit for a ultrasound. So anyway, I went back to the hospital the next day, and the pain had eased, so I was able to drive. Again, I've still not thought how serious this might be, so I've not married family or I just went on my own. So I went, checked in, taken to a side room, you got your own room, and went down for the ultrasound, and they just said, this looks quite complex. So I didn't really know what that meant, and the doctor doing it said, I'm just going to have to get my my seniors to have a look at this. So he sent me back to my room, and then back another couple of hours later for them to redo it. And then they redid it, and they just said, yeah, I don't like the look of this, but they didn't go into any more, sent me back to the room. So I'd arrived at the hospital that day at 11, and then this is about 4 p.m. And then the doctor came to my room and said, we're still not sure what this is, but I finish in an hour, and I don't want to leave this over a weekend, so I'm going to go away, check your bloods, and come back. So he came back at 6 p.m. and he just said, you've got 2 markers for cancer, but we'll wait on the 3rd marker. And then, so that was that. They went, we'll let you know on Monday about the 3rd marker. So anyway, I went home that night, and then I did reach out to friends and family, let them know. I was training the next morning again, physically I felt fine.
Yeah,
I had
yeah.
no pain at this point. The back pain had eased. And so Monday came around, sorry, as well. They said before I left on the Friday, they said they would have an NDT meeting the following Thursday. So anyway, the Monday came and they said my third marker was clear. So I just had the 2 markers for cancer. But it wasn't like a clear cut, you have cancer. And this is where my story gets a bit, I feel unusual, but after listening to some of your podcasts, I don't think it is. So um, I then get a letter from inviting me to go to urology in 5 weeks' time. And my friends were like, we're not happy you're leaving it that long, and I wasn't really. So anyway, I decided to go for a second opinion
Right.
at a private hospital, just for peace of mind, really. Anyway, I took my friend with me, and it was quite clear like what the NHS were doing was the best you'll get, and it does look like TC.
Mhm.
But then before I went to that appointment, I was in a cafe and I got a call from my urology department that I was under on the NHS, and they called up because they'd initially said my urologist was on holiday because this is now August. So that's why it was originally going to be 5 weeks.
Mhm.
And they rang and said, just ringing to confirm what the letter had said. And I just said, I'm just out and I've gone for a second opinion. So they went, oh, I'll just go and speak to my colleague and I'll call you back. And that was that. Anyway, 10 minutes later, they phoned back and then they said, oh, your urologist can see you next Wednesday. So it suddenly moved from 5 weeks to the following week.
Right.
And I said, I just asked, I thought he was on holiday. And they just said, no, he goes on holiday the next day. So again, I thought it was a bit strange.
Mhm.
Anyway, so then I have a urology appointment that I should have had in 5 weeks' time the following week. So then I go and meet my urologist and the Macmillan nurse, and yeah, they confirmed that it was TC. But this is where it gets a bit strange. So he said it's likely TC, but it also could be infection, and we're not going to know until you've had surgery and we've examined it. So okay, and then of course, I'm invited for fertility treatment before the surgery and things like that. And I've been to a few competitions before the Paralympics, and I was due to go out to the Paralympics for a week, and it basically coincided with when my surgery was going to be. So I did
Right.
actually ask if I was able to go, if I felt okay. I wasn't going to take any risk, would I be able to go? And the urologist said, yeah, as long as you feel okay and you take painkillers and wear a mask on the Eurostar, don't see why not.
Mhm.
So that's what I actually did. So I went out to the games to watch some of the athletes, and then I got back the day before surgery in September, and then I had my surgery, and that all went quite well.
Mm.
I just had a bit of a strange reaction to the surgery, because I have cerebral palsy, so I've been a wheelchair user since I was 6.
Mhm.
It affects coordination of your muscles, and basically what had happened when I came home from the surgery, my hip flexor was just really tight, So as you know from the surgery, it's quite an invasive surgery. And they just gave me so many painkillers, but it wasn't touching the pain. And the
Right.
pain wasn't from the surgery. It was, I'm assuming it was just did I recall the hip fracture, or just my body didn't agree with what had happened. I just couldn't turn over. I wasn't comfortable. Anyway, it turned out it went on all day. They've given me all sorts of painkillers and still not touching it. And I remember the doctors coming back in the evening and going, "We've never seen this. You shouldn't be in this much pain. People are normally going home by now." So I'm like, "I know, but I am." Anyway, it turned out I needed a drug which was a muscle relaxant called baclofen, and I got that during the night when a junior doctor was on their ward round, because they actually listened. They were really good and understood that for whatever reason, my body had a bit of a reaction. Anyway, I had that about 7 a.m. the next day, so I ended up staying in, whereas a lot of people go home the same day.
Right.
So I ended up being discharged the following day at 5 p.m. Because as you know, it takes a bit of time to get discharged.
Yeah.
And yeah, I recovered from the surgery all right. And then they booked me in for, I always get mixed up between CT and MRI scan, but they booked me in for a scan. So this is early September, at the end of September. I had that. And then about 4 days after that, had a urology appointment where they had the results in. So between the end of July to the end of September, I actually didn't know for sure it was TC. I was still being told it could be an infection. Even on the day of the surgery, my urologist was there, and after it, he said, "Yeah, everything's gone well, but we're still not sure which one it's likely to be." So yeah,
Right.
at the end of September, they confirmed I had a mixed germ cell tumour. I've got the exact diagnosis I can send you. And then I was referred to the Christie in Manchester for to see an oncologist. So I saw him a couple of weeks later. And then I was given the choice of either surveillance, but it would be like monthly surveillance, or I could opt for one round of BEP chemo. And that reduced the recurrence from 50% to 2%. So that's what I did. And I had that a couple of weeks later. And I finished that sort of mid-November that year. And then once I'd had that, that was it done for me. So and then I'm just under regular follow-ups. So I'm in my second year now. So it's changed from 3 monthly to 4 monthly follow-ups. And touch wood. I've been all right ever since. So
That's, I suppose it's like anything as well. You know, we all want to praise the NHS and the work that they do because they are under a whole lot of pressure. But when you hear the stories like that, especially when it comes to men's health,
yeah,
you know, it's just that kind of poo-pooed thing of like, oh, it's going to be an infection, you know, I'm going on holiday, so it'll be 5 weeks. But actually, you know, it's the wee bureaucratic red tape stuff that's frustrating.
yeah.
Yeah, and for you, did they get apart from painkillers? Did they try and treat the infection, or was it just a case of we're just going to have to remove that testicle?
So initially, when I went to the out of hours GP, it was just take these antibiotics for 2 weeks. So obviously I started them on the Tuesday, and even though I'd been told it might be cancer, I finished the course. And then in terms of painkillers, I've got a bit of a funny story actually. But when I saw my urologist the first time, they did say just take regular painkillers if you do get any pain. But I've not. I've been quite fortunate. I've not had to have any surgery or anything since I was younger. So generally, I don't really take many painkillers day to day. So I was just taking the paracetamol, but
Yeah.
at some point it wasn't strong enough. So I remember going for my pre-op sort of mid-August that year, and I'd been fine up to that point. Still no pain or in the back pain, which subsided after that first couple of days. Um, and for whatever reason, I was in the waiting room in the hospital. And I don't know if it was how I sat, but I did get some pain where the tumour was.
Right.
And I was actually going to a competition that weekend just because they'd said if you feel all right, just carry on as normal. So it was just good to get out of the house. So I went away and my friend was actually driving, and for some reason the pain just got worse. And then that night I just went to bed early, and the next day my friend took me to a pharmacy, and the pharmacy said, yeah, maybe try what was it? So I was taking paracetamol, which wasn't touching it. So I ended up taking oh, it'll come to me.
Cocodamol?
Yeah, that's it.
Yeah.
So
Yeah.
and that really helped. I took that for a couple of weeks. It subsided, and then I'm guessing the blood supply had gone by that point, so I had no pain. And then once I got out to Paris, I had a load of cocodamol with me, but I didn't have to take any of it.
Right.
But in terms of being told what to take, I didn't get any advice. It was more, I'll just take regular painkillers. So I kind of worked out what to take myself,
Yeah.
and through advice of friends. Um,
Which is a shame that's what it comes to as well, that you kind of have to figure it out yourself. You know, it's just not a great advertisement for that.
no.
So when you eventually got told that you were going in for surgery, what was your thoughts then? Like when you were told like it's surgery, did you did you start to think that this is going to be something more serious than maybe the infection, or were you always quite positive that it could be exactly what they're saying, or did you feel that there maybe was something a little bit more sinister lurking?
I think by going through the second opinion, that sort of gave me the mindset that it was likely cancer. So I'd already sort of prepared myself that that's what it was.
Right.
But I didn't know for sure because he kept saying it could be something else. So I'd sort of probably mentally prepared for the worst in a way, but also because I had so much going on at that time, that was a really good distraction. So I think I just managed to crack on with it. And then it was after the surgery and then after the chemo, I sort of realised, oh, that's what's happened, if that makes sense.
Yeah, definitely. And were you like many of the guys that I've spoke to on this? You know, it's like obviously you're still training, you were still coaching. Did you feel that you were at the fittest that you could feel at that time as well?
Yeah, I really was.
Yeah.
But also because of where the cancer was, once I got diagnosed and because of the swelling, I was unable to cycle in because it just what it wouldn't have been the right thing to do. So
Mm,
I actually didn't do anything other than the odd like walking about for 6 months. Um,
mm.
I sort of I try and eat healthy like we all do, but I sort of ate even more healthily leading up to starting chemotherapy just to sort of prepare my body.
Yeah. I just kind of help get you as physically good inside as well as the kind of the muscles and stuff on you. Eh?
Yeah, that's right. But
Yeah.
then also thinking back, I don't know how, but I did quite well. I think I finished chemotherapy on the 16th of November that year, and I think by was before Christmas, mid-December. I was still going to the track, supporting the athletes, but I wasn't cycling. But I think by mid-December, that was the first session I had back on the bike. So within a month of finishing chemo, I was actually back cycling, which I think is quite good.
Yeah, definitely.
So,
Yeah. And with obviously getting that diagnosis and all the medications that can come with that in terms of the chemotherapy and the painkillers, with like having cerebral palsy, did that change how they would approach your chemo, or was it pretty straightforward for you? Was there anything that they had to do different?
for Chris, they were really good. They sort of let me lead it in a way, but I'm also probably because of my coach background. I used to be a primary teacher. I questioned everything.
Right.
So I like so when I was younger I had epilepsy. So I used to have seizures. Touch wood, I've not had one for over 20 years. So because I
Mhm.
wanted to learn to drive, so I learned to drive and I've never had seizures and I don't take medication anymore. Um, but my worry was, would the chemo affect that? So like if I had it, would it? I don't know. So I did question like, what is there any research on people with cerebral palsy having chemotherapy or? And they did actually go away and look, and they came back and said, yeah, we have treated some people recently, and
Right.
they've had similar treatment to you, and there's been no adverse effects. So for me, it was a no-brainer. Initially, I was leading towards just the surveillance. I did give it a week to talk to friends, and then friends were like, "Don't be silly, just go for the chemo." So when you think down to a 2% recurrence rate, it's quite good statistics.
Yeah, it's a scary thought though, like to have that in your own hands as well though, to be able to go uh to be able to have to say like I want chemotherapy. I think that's the strange one, isn't it? Because it's like how do you go around like making that decision like to go, yeah, I think I
Yeah,
want to inject poison.
yeah.
You know?
The way my friend helped me approach it was, yeah, you, it's not going to be nice, but you're not gonna have to have a big dose of it. Like if you opted for the surveillance and it did reoccur, you would have to have a much larger dose. Um, and then when I did have treatment, there were guys in my ward that were in a far worse situation than I was. And I remember one particular guy that we were in the waiting room together when I was had my last round, and because it's like 3 weekly cycles, and I'm thinking he's got to start again on Monday, and I was done. So it made me realise like, yeah, I've got off quite lightly and lucky in a way that just one short treatment can hopefully do the job. So
And keep
um,
you well.
yeah, exactly. So that I think initially I was against going for chemo, but I came round to it in the end because the odds were just far too good.
Yeah, it's a no-brainer when you look at it like that as well, isn't it? Like you
Yeah,
when you kind of go, well, actually, when it really reduces the odds, it really helps. Do you know what I mean? So yeah, I always think it's always better to kind of take the chance on it than not. Yeah,
yeah. Oh no, definitely. And for me, I think my hesitance not to do it was more, how's it going to affect me because of my impairment? But once
hmm,
they'd gone away and looked at that and came back and said, no, people had similar and they've been okay, then that made the decision for me.
yeah.
Um,
And how was chemo for you? What was that experience like? Was there um, did you have much adverse side effects to the actual chemo itself, or is it just something that you've been able to kind of I don't know, what I'm trying to say. Is it something that you managed to just kind of avoid all the usual complications with in terms of, because BEP is quite a strong chemotherapy to get.
Yeah, yeah. Yeah, I did have a few side effects, but I actually felt the chemotherapy went okay. Like the physical side of it, I just got on with. Um,
Right.
I think the hardest bit for me was because I'm quite a slim guy. The main one was water retention. So obviously you weigh you before you start.
Aye.
And I think I put on 6 kilos of weight during the first night, and that was just from the flush out of fluid they give you.
So just all the
So
fluids. Wow.
I remember waking up the first night when I'd finished. Obviously, they take the bag off you, so I was able to go to a bathroom, and I remember washing my hands, and my hands were huge, and I was like, "Is that normal?" I went to the nurse's station and asked, and they said, "Well, we'll ask the doctor." And said, "While we wait, the doctors came down and said, yeah, it's just water retention." So he gave me a diuretic. Um, and then other than that, I was generally okay. It went quite well.
Yeah.
Again, they discharged me. I was in for 3 nights, so the final, or 2 nights. But the final day, again, I had a bit of water retention on my feet, and I questioned it. I was like, I'm a bit staying a bit longer if this needs to subside. But they were happy to discharge me. And I woke up the first morning at home, and I'd blown up again. So my friend took me to the GP. I just got checked out by my GP, and again, it was just water retention. But when you look at yourself, it is a bit scary. But it was fine. That's all it was. And then the only other side effect, really, I was expecting to feel really sick, but
Hmm.
the anti-sickness drugs, is it dexamethasone? I can't
Dextromethasone.
remember.
Yeah,
Yeah, that's what I
dextromethasone.
was
Yeah.
given, and that was brilliant. So basically what the chemo did to me, I just completely lost my appetite. So I ate really well leading up to it, and then I think for a month after it, I hardly ate, and it was just plain things and salty things that I craved.
Yeah.
But
Yeah.
other than that, I didn't eat. Like people were bringing around like nice cakes and things or homemade soup, and I just couldn't
Can do
stomach
it.
it.
Yeah.
Couldn't do it. I tried a few like milkshakes they have like with all the nutrients and you can get from your GP. I had a couple of them, but even them, it was just I was better off just not eating and then it just one day I got up and my appetite returned. It
Hmm.
was weird. That's how it was. But generally, they were the only main ones I got. And then the other thing, I got a bit of a rash on my arm because they gave me the chemo intravenously.
Hmm.
Um, so they said just watch your skin. And one day it was quite red, so I did go into a vet check, but it turned out to be nothing. And then
Right.
I remember my friends laughing at me because I I wasn't moaning, but I was like saying, "Why do I feel not great?" and things like that, like you do when you've got the flu or something. And
Yeah.
they just go, "You've just had chemotherapy. You're allowed to feel that." And I was kind of like impatient in myself, thinking I should feel better by now. It's like you finished chemo a week ago. Just take it easy. So
Yeah. It
I
kind of
was just
feels
being
like
hard on myself.
it feels kind of like the worst flu and hangover combined. I think that's how you kind of feel, eh?
Yeah, that's a good way of describing it. Yeah,
Yeah.
but the main one for me was the actual chemo drugs. When they were going in, I felt okay. It was the
Hmm.
amount of fluid because it took hours for fluid to go through, and that was the hardest bit for me.
Hmm. Did you get any side effects from the dextromethasone? I certainly did. The dextromethasone made me feel like there was a kind of a train getting pushed through my head. That was like I had this compulsion that I needed to move, but I physically couldn't because I was so wiped and so sore.
No, I got nothing,
None.
absolutely nothing. The only thing I had, and I don't think it was from the dexamethasone, I think it was just from the chemo. I just felt really lethargic for
Yeah.
about a month. Um, but I'd say I felt more tiredness when I had bad flu in the past. I don't feel like I was particularly really sick after chemotherapy. I think I got through it quite well. But
Yeah.
I do often wonder if I'd have a second round if because I know is it 9 weeks? Like one normal round of chemotherapy, I'm not sure.
Yeah. Yeah.
What it'd be like if I had to have a sustained number of weeks. I think
Hmm.
it'd be worse, but I think because it was quite a short stint, I was okay.
Hmm. And obviously, like I, with people who get multiple, they kind of um, they'll lose their hair and stuff like that. Did that happen for you with the one? Did you still
Yeah.
lose your hair and stuff?
Yeah, I woke up one morning, it just felt like someone was pulling my hair out. It was a bit uncomfortable, so I just went to the barber and it was empty one day and had it shaved. Um,
Right.
and they looked at me a bit like, "Are you sure?"
You're
I
like,
went,
yeah,
"Yeah," but I just explained what was going on, and they went, "Yeah, yeah, sure." And it grew back. It took a couple of months,
yeah,
but yeah, I lost my hair.
yeah,
But again, that didn't really bother me. I just wore
yeah. And
um,
with
a
that,
hat.
like, so you know how you're talking about like having like quite fatigued and stuff like that. With that fatigue and balance, um, was that kind of different for you? Obviously, you know, like having cerebral palsy, did it affect your mobility more, like being so fatigued, or was it just something that you were able just to kind of go, nah, this is okay, I can deal with this.
Yeah, I think I just had to accept that I was just a bit tired. So if there
Right.
was days where I didn't want to do certain things, I just rested. But yeah, I just sort of managed. I think it was only about a week where I was really tired, where I just lay on the sofa and just let my body rest. But then after that, I was able to go out for walks and things like that. And
Yeah.
the only thing strange that did happen about a couple of months after finishing chemotherapy, I was at a wedding, and of course, you're advised not to be around loads of people because your immune system's low. And they say once your hair starts going back, your immunity's up. So my oncologist said, if you feel okay in yourself, don't stop yourself going to things. So I think I had someone's birthday party before the Christmas, and I went to this wedding. It was a great wedding. But then the next night when I got home, I just started with a fever, and a bit of a cough. But I was still at the point where you checking, we say to check your temperature, and if it goes above a certain point, you're given a hotline number.
Yeah.
Um, so I did check my temperature, and it was fairly high. So I rang 111, and they said, "Oh, come back into the hospital." And then I'm thinking, "Oh, here we go again." I ended up in A&E that night because, and I think the doctor was brilliant. He actually thought I had sepsis. Luckily, I didn't. It turned out I didn't. But I think again, my immune system just thought, "Oh, I've been around a lot of people," and my body was a bit like, "Oh, what have you done?" But other than that, I had no adverse effects at all. That
Well,
one
that's
just
good.
makes me smile. It's quite funny. But
The fact that it's that you get that temperature spike though, you do get a little bit worried as well, like, because you have
yeah,
that pamphlet that says like if you like you say if this your temperature goes a certain level and you're going back in and see as soon as the word sepsis is mentioned, it's just full of dread. I ended up with
yeah,
sepsis when I was going through
yeah,
mine, and it was I wouldn't wish that on my worst enemy. I tell you that.
yeah, yeah.
It's
Um,
and for you, you know, when you get given that diagnosis, I suppose kind of going down a mental health route as such. How did that feel when you were told, yeah, this is definitely testicular cancer, you have a cancer? What were your initial thoughts in and around that, just mentally?
I think at first, because it wasn't like clear straight away, oh, you've got cancer. Um, I think I was just confused and like, well, what is it? Which one is it? And because that dragged on for a few weeks, and then they do move really quick. The NHS British, because you've got so many appointments, you kind of just focus on the appointments, and you don't know what's coming next, sort of thing. And then I liken after I finished chemotherapy to lockdown again, because then I couldn't go out because I was tired. But then you go from having loads of appointments, like on a daily or weekly basis, and quite a lot of support from the doctors or nurses, to almost looking after yourself. It's like, oh, if you get this symptom, call the hotline, but if you don't, just carry on yourself.
Hmm.
And then obviously, I think it was when finishing chemotherapy in the November, it was 3 months till my next follow up. So other than going in A&E that night, I had no follow ups. So you sort of go from like seeing doctors quite regularly to not very often. And I think up to the first follow up, that's where it hits you what's happened, because you've got time to process it. And I don't know about you, I'm better now, but I kind of, it gets to like a week before the follow up, and I start like not sleeping well. And but then weirdly, I've never enjoyed like going to hospitals, but I kind of find it quite cathartic going for a follow up. Just the hospital, because it's amazing, but it's also like just good to hear that, yeah, you're all good, and then you sort of relax for another 3 months.
Yeah. No, I definitely was the same. Before every appointment, my wife could see the change in me, and it wasn't a conscious thing for me either. It was just this thing where, yeah, like you say, the week before, your appointment's coming up, and there's a sense of dread. And although you know that, although you know that there's definitely going to be a kind of not good news, but like news that's you're okay. There's still that worry that, okay, have we got
Yeah,
rid of it? Is the cancer going to come back? And it's draining mentally. It really, really is. You just get exhausted by it.
it is. And also, what I found slightly amusing was like when I like heard I had cancer. And it's the same when you go for your follow-ups. I don't know about your hospital, but I think people think like hospital appointment is an hour or two, but for me, it's almost like a whole afternoon, because you
Yeah.
have to go for your bloods, and that can be busy. And then you wait again for your follow-up appointment. But then you get taken into a room, you've waited an hour to get to the room, and then you wait again for your oncologist to arrive. So
Yeah.
it's overwaiting, especially when it's a follow-up, it's not too bad. But when it was waiting to hear about treatment or what your diagnosis was, it was like I'm not saying it was on purpose, but I just found it amusing, like, oh, we're waiting, because it's like, when are we going to turn up?
Yeah.
And you're just apprehensive to what we're gonna say.
Yeah. Oh no, I think it is. And because it's again, they see that many people that you are constantly just waiting about for hours and hours and hours. I always felt the same. I was like, this is it's your day. It's essentially your day is taken up
It
by kind
is.
of doing it. And yeah, you like the fact that you can get that out the way, but it is a long and draining day. Um, for you, obviously, when you've been doing coaching and things like that as well, how did that help you in any way? Like being like when you were able and fit enough to go back to coaching, did that help you kind of drive forward after your diagnosis and things like that?
Yeah, massively. So obviously, I'd say it was around February where I felt back to myself, and we went away on a training camp in Dubai. I think it was either mid-February or early March um, last year. And so I was away there for 10 days and then a
Mm.
trip to a competition in Switzerland in the May. And then it was the World Championships in Delhi in India in September, October last year. And I wasn't with the team, but sorry, that's my phone. I wasn't with the team, but I just decided to take a trip just to watch athletes and a little holiday after like going through cancer. You sort of think, why not? And just make the most of it. If you're able to have an experience like that, just do it.
Oh, for
Don't.
sure.
Whereas before you might think, oh, I'm not sure I can, or now I'm more like, oh, just do it. So
Yeah.
yeah, I went to India for 10 days last year to watch the championships, and that was brilliant. So I think they really helped me get back to myself as well.
Yeah, and I think it's always good to have that type of grounded thing, and I think that's what people maybe don't always see with sport in general. You know, it's like how, like team sport and coaching and things like that. Really, there's a camaraderie there that is a grounding thing. You know, as people, we are just pack animals, really, and we just want to be
Yeah,
around people. You know, so
yeah, that's it. But I think also we were, again, like I said about the Paralympics during the time when I was being diagnosed and things like that were just really helpful distraction for me. Um,
yeah.
Even like just going the track for a couple of hours, even though I wasn't really doing much coaching, I'd just go and watch. I spot how good it was. Just nice to get out of the house for a few hours.
Yeah.
Um,
And what was your support systems like through that? Like friends and family, like were they obviously, I can't say obviously, but were they dead supportive and kind of help in that way? Were some of them really surprised, or so this is like a almost like a three-part question. And was there anybody who, and you don't have to name names as such, but was there anybody who was quite kind of taken aback that they didn't know how to interact with you after you told them?
yeah, so I have like three close friends who are amazing. Like they're just like they visited me during chemo and came around and dropped food off and like just um like did things around the house for me the like first week and took me to all my appointments and things like that. And also some close family. But also I don't know about you, you also get advice of family like when you first get diagnosed, like or maybe it's say have a phone in your pocket or um to eat a certain diet or make sure you and it's like I remember when I first saw my oncologist, one of the first things I said, like, no, I'm really active. Is there anything I've likely done that caused this? And he
Hmm.
said, with cancer, there's nothing for
Hmm.
anyone can get it. I mean, I have got a bit of a story about risk factors in a minute, which is interesting.
Hmm.
Um, but yeah, on the whole, most really supportive. But when I think some family were a bit like, I don't know if it was like they were taken aback because I'd had it, or if because then there's a family history, they're worried themselves. So I think some family were great, but some were quieter, if that
Yeah,
makes
yeah,
sense. They just weren't sure what to say or what
yeah.
not to say, if that makes sense. But on the whole, everyone was great. And
Yeah, because it is
yeah,
difficult, like having a cancer diagnosis and having to interact with people. I found that like guys who were really close to me, yeah, just didn't know or couldn't interact. And I know like one of my mates, he was dead apologetic after, and I still found he was really supportive, but there was but afterwards, and when I got better, he's like, mate, I'm really sorry that I wasn't there as much as maybe I should have been. I'm like, but you don't have to be either, it's
no,
not yours to go through as such. And I think Yeah, as long as like there's a text or a call, that's more than enough, you know?
Exactly. Everyone deals with it differently. Like I'm the sort of person if I'd help anyone like
Hmm.
any way they want, but not everyone's like that. But yeah, generally everyone was fantastic. My really close
Hmm.
friends and um my brothers were good. And yeah, I think having a support system is like massive. Um, and I think me and my close friends were able to have a bit of banter about it as well, which helped.
Yeah,
Um,
yeah.
'Cause
It's funny though, just to go back to a point that you made there as well though, like you're asking, did I do anything to get this? You know, and it's
yeah,
funny that you do that to yourself. You go, oh, I've got this cancer, so it must have been my fault. It's
yeah,
because I've done the same thing, and most like if you know you've probably heard in the podcast some of the other guys going, "Is this my fault that this has happened to me?"
yeah,
That's quite a difficult thing to kind of process on your own.
yeah. It is, it is. And I just wondered, like, is it? I mean, I know my diet's fairly okay. Is it diet or is it? But like the same oncologist said, it can affect anyone. And obviously, you see the numbers at the hospital. I liken it to an airport. Sometimes it's so busy. The number of people that get diagnosed. I mean, there's a statistic: 1 in 2 people now, or something like that.
Yeah, yeah,
It's big numbers.
yeah.
And
And you were
yeah,
saying that you had an interesting kind of story about the risk factors and stuff. You know, what is it
yeah.
about risk factors that you can tell us in your experience?
So again, this is still being. I mentioned it to my oncology team. They've not come back with anything. But basically, when I was 8 years old, I had an operation because I had undescended testes, um, and I was also born premature, so I was 11 weeks early.
Right.
And bizarrely, I was just at a follow up about 6 months ago, waiting for an X-ray, and on the wall in front of me was it was just some research done in America, but it must be quite important research for it to be in the wall at the Christie, just in the waiting room. And me being curious, I read it, and basically it was a risk factor of testicular cancer in men is low birth weight, um, and also undescended testes because they're in your abdomen. It's the extra heat that can damage them.
All right.
But I
Okay.
just find it amazing that, like, if it is anything like that, I'll never know how it can lay dormant in you for 30 years.
Hmm.
Um, so,
Yeah.
so
Because
yeah, I
we.
don't know for sure it's that, but it's just a bit bizarre that I read that and I've mentioned it to my oncology team and they're looking into it. But if it helps other guys or it helps them notice a risk factor, then. But what I find interesting is I had that as a child, but I've never had any follow ups or anything like saying, yes, it's a risk, so we'll monitor you. So I
Mhm.
think if it is a risk factor, then we should like monitor children and young adults. Is it,
Mhm.
because like you say, the age range is it 15 to 45?
Yeah.
Um,
Yeah.
so
So
if I,
a couple of years ago, we were at the germ cell conference in Edinburgh, and one of the speakers was a professor that, and he talked about this study in America about undescended testes and babies and young boys and the risk factor that that presents. And it's something that we bring up quite a lot. Oh, I bring up quite a lot in my talks to say because people are so surprised. And I think as Cahonas grows, some of the stuff that we're trying to do is now like when somebody turns, like, 15, like it's having a conversation with parents at the get-go because it's hard. You don't want to worry somebody and say, oh, by the way, your baby might get cancer in X years time because
yeah, yeah,
that's not going to be
no,
the case.
no, no,
But I think there is a time where you have to understand the risks of that. And, you know, as Cahonas, that's what we want to drive, and that's what we are trying to do in terms of like our work with the Scottish Government, with this professor, with the Beatson West of Scotland Cancer Centre, is to kind of promote that a little bit more because there's some talks I've done at businesses and people have come up to me and afterwards and went, "My son had undescended testicles. Like, is that?" I was like, "Yeah, I mean, it's something that when he hits 15, he should be doing regular self checks anyway." you know,
Yeah,
and it's promoting that so that he knows he's normal, he knows what's normal for him on a regular month, and if there's any changes, he'll notice them. And that's the biggest point that we try to make is that it's about awareness and the education of that. And I I don't think we can. I don't think it's something you can really tiptoe around in terms of cancer as well. I think if there is a risk factor, and that is it, and it happens to be about young boys, being babies and toddlers when these things are happening, then you kind of have to say because at the end of the day, it could save lives if they have that understanding and that knowledge.
yeah. I mean, what I think, and of course there'd be a cost to this, but if it meant you catch it early, and it would save money in the long run if someone had to have lots of treatment. But like in terms of surveillance, you have your chest X-rays and your scans and your bloods, and that's how we monitor you. So to me, it's like anyone who has a risk factor like that, why can't they just have a yearly blood test or
Yeah,
a scan and just
yeah,
obviously there's a extra radiation to that, but surely that I mean that's the only way they monitor
mhm,
you after treatment. So I can only see that's a way, but I
yeah,
feel maybe because even by just self-checking, which is important, not everyone would. Because I've had friends say I would have missed it or ignored it, and self-checking is important. But if someone's got a risk factor, I think maybe it should be given a bit more on top as well, just to try and
yeah.
find something earlier. Um,
There was this charity out in America who had done a big campaign last year, and they were basically getting know how you get the kind of drug test where you pee in the stick and then
yeah,
it'll do it's almost like a pregnancy test type thing,
yeah,
right? So they'd done that for testicular cancer because the same hormone that can tell a woman that they're pregnant can be the show up as a testicular cancer. So they were giving these packets away, and it never really went anywhere. But it's such a good idea because it's not invasive for one.
mm, yeah,
Um, it's something that you can just have in the house. See if you've got a packet of them and you do it, like you say, like once a month, just peeing on that stick, or once a year you do it, pee on a stick
yeah,
and it tells you, plus doing your checks. It's something that might cost a lot initially, but surely like the cost of MRIs, CTs, hospital admissions, blood tests, X-rays, all that's a cost anyway. So if you can
yeah.
circumvent that but still have guys catching it early, surely that's better.
I completely agree. I also think all that because I think GPs have such a tough job and they do an amazing job, but it's also really hard having good knowledge of every different ailment out there.
Hmm.
But I think because I think that's how I came across your podcast. The first one I heard was I think it was a Scottish GP, and they were talking about they would send if someone presented to them with symptoms very similar to mine, they would have referred straight for an MRI. Well, I
Hmm.
went to and out of hours GP. Yeah, I was told to take antibiotics. So I'm not saying that, but again, if anyone's got a similar symptom, surely it's better just to err on the side of caution and go for
Yeah.
a ultrasound. Uh,
I think you're right, and I think that it would be Dr. Mike that was that podcast that
mm,
you listened to, and he's so right. And we've had too many guys, like obviously as somebody who listens to the podcast, the amount of guys who have been in a similar situation to you where they've went to the GP or out hours or somewhere and they've went, it's going to be an infection, it'll be fine. And we understand the numbers of testicular cancer are lower than most cancers out there. How and ever. It's still happening. And there's still these guys who they're presenting to the GP. And the Nathan McCann episode is a really good episode for that, because Nathan presents as somebody who checks his testicles and goes, no, I have found a lump that wasn't there last month. And they're still like, no. You know, and 6 months later, he's having to get a private scan.
Yeah, yeah.
You know, and that's the type of thing you want to evolve. So I think having these like little tests or little things to just help the GPs understand that when it comes to men's health, there is a stigma still around it in terms of like how the medical community look at testicular cancer, but you still have to check, guys. You know, so
You do. Yeah, you do. I think that's the thing with it, is the symptoms are so something or nothing in a way. Like for me, it was just the swelling, nothing more. Yes, I got back pain eventually, but I'm really glad I got the back pain, because had I not got that, I wouldn't have gone to the hospital.
do you not think you would have, like, for the swelling in your testicle, do you not think that would have been something that made you go, no?
No, I would have finished the course of antibiotics and I would have gone back to the GP, but then who knows whether they would have sent me to
Right.
an ultrasound. Who knows? What I'm saying is the back pain probably progressed things
Yeah,
faster in a way.
I know. Which is good and it's not, because you don't want to have
Yeah,
pain, but it's
yeah,
good
no,
that it happened
yeah,
as well.
yeah.
Yeah, I know. And obviously, like, for your experience, you know, what do you think stops men from linking those early signs or risk factors to something more serious? Do you have an opinion on that? Like, do you think there is something that's really inherent in men that stops us?
I think it's just the symptoms. Like, I don't know, if you got symptoms like you notice blood or you got horrendous pain, you're more likely to go. But I think because the symptoms are so mild,
Hmm.
I think for a lot of men especially, I think, oh, I'll just see how it goes for a few days. But I've had friends and family since like ask me like, I've got this, and I just say to them, just go to a doctor, just get it checked, because
Hmm.
there's no harm in getting it checked.
Yeah. Oh, definitely. I think that's the thing. I think most men only learn about things like undescended testicles and testicular cancer once it happens, or it causes
Yeah,
a problem. Because there'll be guys out there who have had undescended testicles that don't know, because they've
yeah,
had it as a baby, it's been connected, but like mum and dad, you know, it's like that's something, it wasn't a problem, it was fixed, and then 40 years later they're going, did I have this when I was a kid? And like, yeah, oh sorry, did we not tell you?
yeah, exactly, yeah, exactly. So,
Yeah. So yeah, I suppose just kind of rounding up, I suppose, if you could go back to yourself and speak to yourself at the very beginning of your testicular cancer journey, is there something that you would want to say to yourself then that you kind of know or feel now?
yeah, probably just um, I think early on, my friends were great. My friends made me question things a lot, but I think we go to a doctor sometimes and I don't want to use the word trustful, but you kind of think they're a professional, they know what they're doing. And it's not they don't know what they're doing, but you've also got to advocate for yourself a lot as well. And I think a lot of people aren't so comfortable doing that, but that's exactly what you have to do. Um,
Hmm.
so I think just question everything and get as much information as you can. And in the end, that's what I did. But it was my friends that helped me do that. Because I think initially you're just worried. You you're not thinking clearly, but you've got so much going on the last thing you want to be doing is questioning doctors or asking if there's other possibilities or other treatments. But that, unfortunately, that's what you have to do.
Yeah, I think that is a great takeaway. It is question everything. You know, especially, I think if you are starting to do regular self checks and you know there's something different, if you're aware of your body and you know that there's something wrong, then it's definitely worth asking for that second opinion. You know, and there's nothing wrong with that. Most GPs should want a second opinion as well. You know,
Yeah,
it shouldn't be anything that's you're not offending them. You know, you're not trying to say they're wrong, but when you know that something isn't right for you, it's just advocate for yourself in that way, isn't it?
yeah,
Yeah.
it is. It is.
And finally, you know, like, what do you want people to take away from your story? What is it that you want the kind of takeaway to be for this?
I think just that obviously the earlier you notice a symptom and you do present to a doctor, the better the outcome in a way. Really, you find it. The treatments are so good now.
Hmm.
But regardless of when it's found, it is amazing what we can do. But really, you find that if you do have to have treatment, the less treatment you have to have. So it's even
Hmm.
more important to catch it early. But also, the main takeaway is that it's also on yourself to notice symptoms. So just educate yourself as much as you can and do go to a doctor. That's the most important thing. Because I've heard like podcasts or stories of people that have like left it for months or years, and then they've had to have far more treatment than I had. And to think that that happens just from leaving a symptom is um, is crazy, but it's understandable as well. Because I've had friends saying I would have probably ignored it. So like I've said, the symptoms are so mild.
Yeah, yeah, yeah. Well, mate, thanks so much for doing this, and thanks for taking your time to to tell us your story. It's like I say, every story is important, and every episode that we do is something that somebody out there is going to connect with. And as long as we keep doing that, and as long as we keep having guys find their voice like yourself and be able to kind of talk about this, it's only going to benefit people, you know. And I know that I say that kind of self-servingly, but it definitely does, because I've had that feedback. You know, your story is going to help somebody, and that's only a good thing. So thank you.
Yeah, no, that was my reason for doing it. If it just helped me makes one person go to a doctor or just listen to it like I did and realize, oh, it's not just you yet. Because I think I thought, because for months I wasn't sure quite what it was. I thought that was a one-off and that it just happened to me, but through listening to your podcast, it turns out it's not. And so I think it's helpful for others just to hear other people's stories, whether they're similar or not.
Definitely. Well, thanks, mate.